Let me thank all of you for once again coming to Harrisburg, coming to your state government, and making a plea for folks who need us to listen, to hear, and to act on their behalf. We were sent here to do a job, and with only 8 additional Senate days left on the schedule for us to do that job, the time is waning. Representative Eaches, who's been an incredible, thoughtful, wise champion on this issue for years, has done his work. He got the bill out the House. The bill has passed the House. The bill is ready to go. The governor is ready to sign the bill. Am I right, Jay? He's ready to sign the bill. The bill passed the House. Passed it nicely. 118 to 81, is that the score? Like what we're getting ready to do to Steelers on Sunday. I had to get it in there, I'm sorry. But the bill passed the House nicely. You did a great job. You really did a great job navigating that whole system to make it happen. And we should be proud of your efforts. You should be proud of your own work. Now it's sitting in the Senate. Senator Costa and I, since last winter, since last year, have been getting up on the Senate floor every day. About 80% of the days that we've been in session, we've stood up on the Senate floor and said, let's take action now. The people can't wait. The people can't wait any longer. We don't have any more time. Janine Peterson, I went to a nursing home last week in my district. This young lady working in her mid-20s. That's about 27, 28 years old, working, taking care of mostly senior citizens in the nursing home. And you could tell by the look on their face she was doing a good job because they really liked her. They liked the work that she was doing. They liked how she was paying attention to them. They liked how she was taking care of them. So after the meeting was over and we tried to help out everyone there, she pulls me aside, and this is the honest-to-God true story. She said, Senator, I really need some help on this health care thing. I said, what do you mean? She said, I can't afford the costs that they're charging us for health insurance here. Now, this is a nursing home, which means you know that they don't have the kind of health care coverage that we have here in the General Assembly. So they have probably a meager program, but it's too expensive for her to afford. She says, I have a son, but he's covered on his father's program. I can't participate in his father's program, so I'm left hanging out here. I'm taking care of people, but I can't get care of myself. I can't afford it. It's too expensive. And here again, she's working in an environment where she's put herself in a difficult position because working with other folks whose health care is not at the highest level, she's susceptible for getting sick herself. She's in a greater risk factor working in a nursing home. Why are we waiting? What is the problem? What is the reason why we can't get this thing done? The governor's ready to go. The bill has passed the House. We got, at the very least, 21 Democratic senators ready to support it, ready to vote for it. What is the problem? The economic condition is getting worse. I just got a report today, the largest number of new constructions not happening in 17 years. Unemployment rate skyrocketing. The financial house is collapsing. Why can't we stand up for these people? We can figure out a way to stand up for Merrill Lynch and AIG. Why can't we stand up for the average everyday person? Why can't we step up for them? Smith Barney, somebody stood up for Smith Barney. I like that guy at the Democratic Convention. He said, my name's not Smith Barney. My name's Barney Smith. I wish somebody would stand up for me. And that's true. We can stand up for all of the big in the world, why can't we stand up for these big shots right here? Why can't we provide them the health care? Senator Costa was right. He applauded all of you for coming back in and day out, week in and week out, coming back to here asking for some reason and some rationality, some sense of sanity in what sometimes can be an insane place. Help the people. The money is there. There will not be a tax increase. It's not going to cost anybody any money. We all negotiated, worked it out. The doctors will still get paid for it. There's $1 billion surplus in the M-Care fund. We take half of that, take care of this problem. The doctors still get taken care of. Not an issue for them. It's interesting. We have provided $1 billion of financial help for the doctors. But we can't find a penny to take care of these folks right here. What's the problem? What's the problem? Stand up, everybody. Let folks know the rage that you feel. Activate, activate, activate. Agitate, agitate, agitate. Preach on it, Pastor. Speak on it, community worker. Let's get, they talk about community organizers. Like they don't have a clue of how important that they are. Organize. Lift up your voice. Let these folks know that we can't go out of here. That in fact, we should be mandated, charged to be brought back in until we get this thing done. We should be charged to be brought back in here. Governor, you should charge us to get back up here in the Senate body and don't allow us to leave until we get this thing done. What do I say to that nurse, that young lady who's doing the right thing? She's doing the right thing. What do we say to her? What's the message to her? And all of the hundreds of thousands of other folks who are trying to do the right thing, play by the rules, and make a difference. Can't we stand up for them like we stood up for everybody else? Thank you very much.